Question number 5, Barbara Kuriger.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, can he confirm preliminary data from the National Patient Flow Project which shows that 90% of patients referred to their GP by their GP to a hospital specialist between the 1st of July and the 30th of September 2015 were accepted for a first specialist assessment?
The
Mr.
Honourable
Speaker.
Dr Jonathan Coleman.
Yes. Although this is preliminary data, it indicates that of 145,922 referrals to hospital specialists during that period, 90% or 130,000 received a specialist appointment. This is the first time that any government has provided transparent data on the outcome of GP referrals to hospital specialists.
Mr Speaker.
Supplementary question, Barbara Kuriger.
To the Minister, what reports has he had on the number of surgical and medical first specialist assessments carried out in the last 7 years?
Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, I'm advised that there were 542,000 first specialist assessments performed across the country. That is 110,000 or 26% more than the annual number performed in our first year in government. The only answer to increasing demand is to do more, and this government is.
Supplementary question, Barbara Kuriger.
To the Minister, what percentage of referrals are sent back to their GP?
The Honourable Dr Jonathan Coleman.
Mr Speaker, on the preliminary data, 4% were sent back to their GP, but as the data firms up, that's expected to rise to 10 to 15%. No government in New Zealand's history has ever been able to give every patient every appointment they want, but the focus of this government is to continually increase access to services, and we are.
Question